Hi guys, Dr. Shepard here, co-founder of Small Genius Dental. Just want to give you a few tips on what I do to assist my refinement so I can avoid doing refinements at the end of treatment. And if you don't know what a refinement is when you have to rescan the patient or take new impressions, and then you have to print some additional aligners to finish off a case. So you have a few teeth that maybe haven't moved exactly where you wanted them to move. So it's very simple. What I do, a lot of people ask me all the time, and they say, how do I get results without additional refinements, which a lot of people, they will maybe do refinements on 60 to 70% of their cases. So, but the ideal thing is to get a good set of dimple pliers for your clinic, okay? So a lot of different shapes and sizes. I prefer using this one the most. This is the 1mm dimple plier. It's really good for just putting a dimple. And if you don't know what a dimple plier is, it's a device that you use to place an elevation inside the aligner to push the teeth a little bit further. So you would just literally push an indent in the aligner, and that will create an area of resistance to push the tooth into wherever direction that you want it to go to. So the two main things that I have trouble with when it comes to finishing off a treatment, and a lot of you will attest to this, is when you have extreme crowding. You have one or two teeth that sometimes don't make it all the way into alignment, or if you have an extrusion of a tooth that doesn't fully go into the shape of the aligner. So basically you'll have an aligner like this, and then you'll have a tooth kind of just sticking up like this, and you want to pull it down all the way into the aligner, so it just ends up being like that. And a lot of the times this happens just because the shape of the tooth, maybe you have a tooth with an incisal edge, and incisal edges are not really made to grip onto the aligners unless you have attachments on those. So these techniques will help you. So my main technique is this. So if you have a tooth that needs to be rotated or pushed in either forward, backwards, what you can do is you can place a dimple on the opposing side of where that should be located. So let's say you had a tooth which didn't fully make it labially, and you want to push it forward a bit. And first of all, you would see, for the simple fact that there would be a space in the aligner in front of that tooth. And the whole point is you want the tooth to be pushed into that space. So you would put a dimple on the opposing side, or maybe two dimples on the opposing side, and you can go ahead and push it. Now there's different types of dimple pliers. For instance, I have more of a straight edge dimple plier, where I can put a longer dimple on the inside of the aligner. So it's not just a small 1mm dimple. It's a nice long rectangular shaped dimple, so you can push more of the tooth surface at the same time. So yeah, you can push it in any direction. So let's say you want to, and you would put that dimple until the tooth moves into the correct location, which usually takes a couple of days. Now, if it was the opposing way, you would put dimples on the vestibular surface to push the tooth back. Also, if there's rotations, you can put one dimple on let's say on the labial, like let's say you're trying to rotate distally. Well, you can put one dimple on the distal surface of the labial side of your tooth, and then if it's an upper tooth, you put one dimple on the mesial-palatal side, and then finally that will put rotation on the front and back of the tooth to finish that rotation off. And again, you're always trying to put the dimple on the opposing side where the space is located inside your aligner. So wherever the tooth is not filling in your aligner, you want to put the dimple on the opposing side. Now, bear in mind, you'll have to go back to your plan that the lab gives you, and you might have to look at the IPR that they've suggested, because you might not have done enough IPR, and that's why you're running into these issues. So you might have to go into those proximal surfaces and just file through a little bit more to allow space to rotate, to allow those aligners or the teeth to complete the movement. Now the other thing would be extrusions, bringing the tooth down out of the bone. And one way to get rid of that, so you can avoid refinements, is that you need a hole punch. Okay, so a hole punch looks like that, where you have a big flat round edge and a nice open surface, and you would place, first of all, two hole punches over the teeth that you need to pull down into the aligner. And where you've placed the hole punches, on the tooth surface itself, you're going to put buttons. And the button is is a composite material, basically, or metal. But people prefer using composite though, or anything tooth colored with the aligners, where you're going to place an elastic. So you're going to put one button on the vestibular surface at the cervical, and one on the oral surface of the cervical. And with the aligners on, and in that area that you've cut out with the hole punch, okay, you're going to place a dimple an elastic from one dimple around the aligner to the other one. And the whole point is for that to pull the tooth down into the aligner. And this does happen quite often if you're trying to pull down, especially for open bites, etc. if you're trying to get the teeth totally level. So try that out, let me know how that goes, and we'll catch you on the next session. All right, take care of yourself, and we'll talk soon. Yeah, I hope you guys enjoyed my tips. If you are interested in Smile Genius, of course, you know what to do. Hit the demo button, and we'll be more than happy to speak to you about how we can increase your clinic sales, as well as just improve the entire treatment process from start to finish with your clear aligners. All right, in the meantime, take care of yourself and talk to you soon. Bye.